Hey, this is Dr. Blundell with BVOMS, and in this video we're going to talk about the care instructions for after you've had your wisdom teeth removed. First, we want you to be very gentle with those sockets, particularly these first several days or so. So diet-wise, we're going to want you to start with liquids, soups, and very, very soft things for now. And again, ideally you hang out there for those first several days, but technically as you feel up to it, you can start kind of gradually going back towards your normal foods and drinks. Second, you've left the office with some gauze pressure packs directly over those sockets. We want you to stay closed nice and tight on those for the first 30 minutes or so, or until you get home and settled, and then you can take that set out. Once you take that set out, if it's still bleeding a little bit, which wouldn't be abnormal, you've got some extra gauze in your little bag that we gave you while you were in the office. I want you to take one piece of gauze for each side. You're going to fold that piece of gauze in half. You're going to fold it in half again, and then you're going to roll this up into as tight a little roll as you can. One of these for each side. And then an important piece is you need to position these directly over the sockets themselves. One of the common things that we see is that they don't get put directly over the sockets, so they're underneath some other teeth, so you're not actually putting pressure on those sockets, which is what we need for those blood clots to form. So one on each side, way in the back, directly over the sockets themselves. You're going to bite down for 30 minutes. And you're going to keep doing those 30-minute cycles until you don't feel like you need any gauze in there anymore. A couple of things to think about. If you're going to lay down to take a nap, take the gauze out. If you're going to eat or drink, take the gauze out while you're doing so, and then you can put them back in. And then the other thing to think about is as you get a little further out from surgery, sometimes the blood is just mixing with saliva and it makes it look like there's more blood than there really is. As soon as you get to a point where you don't feel like there's any more active bleeding, start trying to leave those gauze pressure packs out, because sometimes as we get a little further out, us taking them in and out is just stirring things up more than it's actually helping. Next, you probably received some prescriptions ahead of time, and we're probably going to send some prescriptions over the day of the procedure as well. Now this can differ from person to person, case to case, depending on your particular history and also your particular procedure. But the most common medication regimen is that you probably received an antibiotic mouthwash ahead of time and some prescription strength ibuprofen ahead of time. And in some cases, you may have received some antibiotic pills to take for a couple of days. So if you did receive some antibiotic pills, just keep taking those until they run out. It should only be another dose or so. When it comes to your antibiotic mouthwash, we want you to start that the day after surgery again. And then you're just going to rinse morning and night after you brush your teeth for this next week. When it comes to pain control, we definitely want you to start with that prescription strength ibuprofen if you received that. You're going to use that every 6 hours, and usually you want to use it pretty regular for those first few days when we know there's going to be some discomfort. If you've received an additional pain medicine, oftentimes that's a hydrocodone Tylenol mixture, but again, every situation is slightly different. If you did receive that second prescription, that can be used on top of the ibuprofen if and when you need extra help. And it can be used in one of two ways. It can technically be taken at the same time as ibuprofen, every 6 hours, or they can be alternated every 3 hours, which seems to help folks more because you're getting something more frequent, so it kind of smooths things out instead of having these big swings in pain. So the way that would look is ibuprofen, 3 hours later, your hydrocodone Tylenol mixture, 3 hours later, ibuprofen, and so on and so forth. For those of you that didn't receive the hydrocodone Tylenol mixture, or those of you that don't like the way that makes you feel and don't want to use it, you can substitute over-the-counter Tylenol into that 3-hour dosing window instead of the hydrocodone Tylenol mixture if you so prefer. Lastly, some of you guys have received a visit to come see us in a week for a quick post-operative check. Others, we've told you that you don't absolutely have to come back and see us. And again, this is oftentimes based on your procedure, your teeth, your clinical situation. For those of you that didn't receive an appointment set in stone, we've probably also told you, though, that we want to hear from you at any point if you need us. So what I tell folks is if by next week things don't seem like they're getting better, definitely if by next week you feel like things are getting worse, or at any point along the way you have questions or concerns, one of us is always available, whether it's after hours or over the weekend. You can always reach someone, and we can always get you in and take a look if we need to. For those of you that don't end up needing to come back next week, you've also received a little syringe in your bag with some instructions on it. And essentially what those instructions say is we don't want to use that syringe for this first week, but starting day 8, you're going to start irrigating those bottom sockets morning and night after you brush your teeth. The bottom sockets heal a little slower than the top, and because of gravity, they usually collect a little bit more food and debris than the top. So, morning and night after you brush your teeth, you're going to take your syringe with the little curved tip, put some water in that syringe. Tip of the syringe goes just into the top of those bottom sockets on both sides on the bottom, and then you're going to irrigate them out real good to keep them nice and clean. Again, we don't want to start that till day 8 because we don't want to irrigate them too early and then lead to a dry socket or something. And then once you start day 8, you're just going to do that morning and night until you can't find those sockets anymore, until they just finish covering over. Everybody's different, but for most people it's 2-3 weeks of just irrigating them out like that morning and night until it gets to a point where you don't need to do so. Okay, so these have been the post-operative instructions for after you've had your wisdom teeth out. Most of this is probably review. We've probably already gone over this with you in the office, but hopefully this video serves as a resource that you can reference at any time along the way if you need a reminder or to refresh on any of this content. But as I mentioned earlier, don't hesitate to reach out to us as well if you have any questions. We hope you have a speedy recovery, and let us know if you need us. Thanks.